I will be doing a training video where I will introduce a case study that is based on a real person but is going to be kept confidential for professional reasons and in order to protect the client's rights to confidentiality. Um, I will introduce the client as well as show how you are to conduct a professional meeting. The client participating in the session we're going to use the Substance Abuse Resource Center, is a 22-year-old Caucasian female student with a passion for art. She has never been married, but currently maintains a boyfriend who has no interest in partaking in the consumption of alcohol. Because she faces difficulties identifying meaningful relationships on a meso level, she finds herself unable to sustain a relationship. The normalized idea of a macro level lifestyle on campus, along with her surrounding peers and a micro level history of alcoholism within her meso family structure, has led the client to increased confusion in her sense of self, leaving her with feelings of hopelessness. The relations she maintained with her meso structure, such as family members and friends, reinforced her drinking habit rather than serving as a supporting factor to discontinue her use. I will, within this training video, I am going to be a practicum student who is practicing how to conduct a meeting with a client. First, we're going to start with the engagement of the client. When the client entered the office, it was apparent she was distraught. In order to begin the session, the practicing worker introduced herself as a practicum student, and she requested the permission of the client to sit in on the session. Due to the practicum student being with a supervisor, it will be 3 people. It will be the supervisor of the Substance Abuse Resource Center, as well as the practicum student who will be conducting the meeting with the client, and the client, which makes 3. After gaining the client's permission to sit in, an explanation of the legal obligations to keep the client's identity and disclosure confidential was given, as well as the purpose of the Substance Abuse Resource Center. The worker was dressed in a business suit, carried herself with what could be an intimidating professional poise, but because she introduced herself as a practicum student, there was an equal distribution of power that was initiated due to the familiar understanding of the demands a student role contains. According to Lundy, reducing the power between client and worker is integral to the helping relationship. Morrow and Faust elaborate on this idea by furthermore stating that placing limits on a professional role enables a balance in the power. By distracting the client from perceiving the worker as an expert, it enabled the client to speak more freely about her concerns. After engaging the client by introducing common roles, an explanation was requested for the reason for the visit. The discussion was collaborative, and she was comfortable in disclosing the micro-level difficulties she was experiencing discontinuing her use of alcohol. She was aware of the cycle of her alcoholism and was in search of resources to break this pattern. Beginning the session, she seemed to have her emotions securely tucked away, but as the worker encouraged her to explore the problems she was facing by means of seeking clarification to the discussed topics, she exposed the pain she felt from lacking stable support in her journey towards sober living. Maintaining proper nonverbal behaviors and seeking information on a client's issue assists in a comprehensive engagement between the client and the practicing worker. At the beginning of the session, it is difficult to maintain eye contact with the client due to the control of the session being led by a competent supervisor. In order to prevent the manifestation of the client feeling as though she were a test subject for practicum requirements, clarification was sought out from the client on various discussed topics. Attentive eye contact was maintained, and brief reflective responses were given to communicate the understanding of her situation. Through seeking clarification, reflecting information, and maintaining eye contact when the client was speaking, a comfortable sense of balance among the group's exchange was enabled, and the client equally engaged with both the supervisor and the practicing worker. Observing the client break down over the lack of control she felt over her addiction to alcohol enabled the worker to empathetically reflect content relevant to the reason for the visit. The client reflected on micro-level difficulties involving maintaining a healthy relationship due to her past biological makeup and current depressed state, meso-level difficulties involving her surrounding social group and family members facing alcoholism, and her macro-level difficulties with an on-campus lifestyle and the promotion of bars as the main form of entertainment. The warmth the worker offered proved to be an essential asset in the development of the client's confidence in their working relationship. According to research done with client engagement in drug treatment, data has shown that female clients are more responsive to an empathetic counseling style. This is according to Florentine, Nakishima, and Anglin in 1999. The concern displayed for the client's well-being through it actively listening to the purpose of the visit was apparent in the session and enabled the client to speak more freely about the difficulties she was facing. The next step in having a meeting with the client is assessment. First, we will analyze the biopsychosocial. During the explanation of the client's drinking habit, she was able to present evidence as to how she inherited her desire to drink and how it affects her meso-level relationships. The first dilemma discussed was her upbringing with her biological mother and father. Her mother and father suffered from alcoholism, and at a young age she was forced to take on the role of the caregiver. Because she was forced to care for her parents, she was unable to have a structured upbringing. Lacking the proper parental figures to guide her through a stable development, her micro-level perception of a healthy relationship and coping is blurred. As a teenager, she used her artistic talents to express negative emotions she internalized, but now feels as though she has lost her healthy outlet due to pairing it with social drinking. As a young adult, she adapts to her stressors by using a daily consumption of alcohol as her coping mechanism. She finds herself surrounding herself with meso-level systems of individuals who drink heavily and are unable to care for themselves because it is familiar to what she knows. Due to her current boyfriend lacking interest in drinking, she has found herself uninterested in partaking in social activities with him. Her confusion regarding her sense of self has led her into a depressed state, supported by her feelings of loneliness, lack of interest in activities she once enjoyed, a loss of appetite, and inability to sleep. The target problem. Due to macro-level college lifestyle being so influential to students, the client feels as though she is stuck in her alcoholism. She currently engages in a mutual relationship with her boyfriend, but due to the confusion she faces with her sense of self, she feels the relationship will soon be non-existent. She has made an attempt to reach out to her mother and friends for support, but because they are also battling with their own alcoholism, they lack the ability to competently give her support and instead contribute to her continuous drinking habit. Not only does her support system consist of other drinkers, but she is also surrounded by the promotion of bars as the main focus of entertainment, as well as her art shows being centered on the consumption of alcohol. The client's awareness of her situation contributes to her consumption of feeling hopeless, putting her in a cycle of depression that ultimately leads back to self-medication as a means of treating her depressed mood and depressive mindset. More specifically, alcohol consumption is thought to reduce negative symptoms such as depressed mood and anxiety, an example, dysphoria, linked with stress-related disorders, which ultimately results in self-medication, according to Bolton and Robinson in 2009. Acute and chronic stressors are also may be important in regulating craving and may play a significant role in the relapse to alcohol and drug dependence, according to Breeze and Sinha in 2007. According to the article Readiness for Change, readiness for change is determined by three factors: recognition of the need to change, willingness to change, and capability. During the session, the client presented recognition of the need to change and willingness to change, but the capability to change is a more difficult task to follow, considering her physiological ecology. The client displayed a strong sense of self-awareness through her knowledge of unhealthy relationships within her social network and patterns of behavior she displays within her relations. Because the client is being forced to unfold resentful emotions she would usually mask with alcohol, she finds herself picking arguments with the people closest to her, such as her boyfriend. The assessment tool used here was a motivational ruler that I actually made. During the assessment phase of the session, the worker provided a motivational ruler in order to further evaluate the client's needs and readiness to change, as well as determine whether the offered services enhance the client's well-being when given again in the evaluation phase. The motivational ruler consists of questions rated 1 through 5 based on the client's current issue with substance use, with 1 translating to no issues, and 5 meaning it impacts it greatly. After filling out the ruler, the worker found all 5s had been placed in the request and answer section, meaning the severity of the dilemma with alcohol was severe during the assessment phase of the session. Next, we're going to use a strengths-based perspective in order to assess the client's strengths. Using a strengths-based approach proved to be efficient in discovering positive aspects of her situation and sense of self. From the perspective of the client, being able to assess one's strengths effectively contributes not only to solving an immediate problem, but may also augment the client's ability to deal with future problems, according to McQuaid and Ehrenreich in 1997. The objective with the client was not to enable self-doubt and a feeling of hopelessness, but rather empower her thought process and foster a sense of hope. According to the article Alcoholism, a client needs the opportunity to ventilate, to be assured that the drinking is not her fault, that she is not going crazy, but is caught up in the family illness of alcoholism. Rather than focusing on what she is not capable of, the worker instead maintained focus on what she is capable of doing. As a social worker, we are to empower our clients so they may feel they can achieve their desired change. During the session, her motivation to attend the meeting was acknowledged as a strength, along with the courage she displayed with her request to meet. As she described her experiences supporting alcoholic parents and the influence it has on current relationships, she was informed that her self-awareness is an attribute that many individuals with similar trials have difficulties perceiving. Children of alcoholics, or COAs, are recognized as a population at risk for developing potentially long-lasting emotional, social, behavioral, academic, and physical problems as a consequence of prenatal alcoholism, according to the Journal of American College and Health. They further explain this by stating that children of alcoholics have a 3 to 5-fold increased risk of developing alcoholism compared to children who were not raised by alcoholic parents. During the session, the client willingly explained the difficulties she experienced caring for her parents as a child and how they affected her through her thought process regarding relationships as an adult. Revealing this information led to a cognitive behavioral approach as a means of intervening. As the worker spoke to the client about her alcoholism, passive responses were noticed, such as, "It's okay, I guess I just couldn't do it, I'm not strong enough." Although this negative self-talk may appear to be a weakness for the client, Aldwin, in 1994, observed that although routine denial of self-deception is generally perceived as antithetical to psychological health